Hello, everyone, and welcome to the Argentum Take 5 webinar, Actionable Solutions to Current Industry Challenges. Presented by OwlSure, today's webinar is titled From Insight to Impact, How Smart Dashboards Drive Strategic Decisions and Operational Wins in Senior Living. My name is Emily O'Connor, and we're delighted that you've joined us today. Before we dive in, a quick word about our sponsor, OwlWise. You may remember them from previous Argentum events as Owl Health and Care Technologies. They're focused on providing digital solutions for senior living and healthcare. They help industry leaders unify data, modernize workflows, and activate business intelligence so that teams can make faster, better decisions. Before we begin, let me remind you of a few housekeeping items. All attendees will be placed on mute as they enter the webinar. You will have the opportunity to submit text questions to today's presenters by typing your question into the Q&A panel at the bottom of your screen. You may send your questions in at any time during the presentation, and they'll be addressed at the end of today's presentation during the Q&A period. The webinar is being recorded. You can access the recording within 72 hours at argentum.org/take-5-webinars. Today's discussion will be approximately 30 minutes. Joining us today are two speakers, Rob Mascara, the Chief Information and Innovation Officer at Parker Health. Rob leads Parker's transformation into a data-centric organization and will share firsthand insight into the innovation he is envisioning and executing. Our second speaker is Venkat Murray, Head of Healthcare at OwlSure. Venkat brings deep experience in senior living and technology and the solutions that these offer to the sector. Rob will take us through the key takeaways of Parker's journey, and Venkat will talk through the current needs and will describe how the future of the industry could look. Let's begin today's presentation by understanding why dashboards matter now. Venkat, over to you.
Hey, good afternoon. Good morning, everyone, from wherever you are. Thanks, Emily. Let's set the stage. Thanks, Rob, for being on the panel. In recent times, senior living leaders are under intense pressure for various reasons: census volatility, staffing shortages, narrowing margins, and escalating regulatory demands. Many communities, senior living, use dozens of systems, from EHRs to HR software to finance to clinical systems, and they rely on manual spreadsheets for some of the insights. It's a case of data everywhere, but insight nowhere. Dashboards are not just pretty and colorful charts that we are seeing and talking about today. They are strategically organized assets. They give leaders insightful visibility into census, staffing, finances, and quality metrics, enabling proactive decisions rather than reactive firefighting. To get us thinking, we would like to hear from you all, the participants, thanking you all. If we can take a polling today. The poll question today is, where do you feel the lack of insights the most? Please select the options that resonate the most from the choices below. We will share the results in a moment to see where the audience stands. Well, thank you everyone for sharing. Here is what you all reported. Expectedly, all the above has the highest poll. We see 37% of you struggling with most of the above or all of the above as lack of insights. And 19% said census and occupancy tracking is a troublemaker. and 33% said staffing and labor costs, and 19% stated financial performance and budgeting is giving some trouble in tracking as an insight, and 22% has quality and compliance metrics as the troublemaker in providing insights. This is about what we expected and what we've been seeing in the industry for quite some time. Very much in line with what we usually see, and leaders consistently point to all of them as the top challenges. This poll and your response reinforces that the struggles we are talking about today are widespread and not isolated. Now, Rob, will you please explain about Parker's aging services and shed some light on how you are getting insights from the multiplicity of data source systems you have? Over to you, Rob.
Sounds good. So let's get started with who we are. Parker is a not-for-profit organization founded in 1907 by Henrietta Parker. We're headquartered in Piscataway, New Jersey, central New Jersey, and the organization operates under the mission to make aging part of life. It's become a national thought leader in aging services. Like I said, we founded in 1907 by Henrietta Parker, Central Jersey. We really focus on residential care, including assisted living and long-term care. We have specialized care, including post-acute rehabilitation, community services, including adult daycare, health and wellness programs, and even in-home care. We are based, like I said, based in Central Jersey, Highland Park, Piscataway, Monroe Township as well, Somerset, and our original home is in New Brunswick. That's where Henrietta Parker actually started, and that's part of why we have such strong ties to the community, strong ties to New Brunswick. We employ over 800 dedicated care partners, and we work with over 300 volunteers. So now let's flip over to the next slide and discuss some of the challenges that we've actually had. Previously, we relied on manual spreadsheets, emailed reports, siloed data sources, and a lot of manual processes, whether it was just tapping on the shoulder or conversing in the hallway, just like anyone else. Hard to put together census and staff data to even arrive at some of the staffing decisions, and lack some timely insight for some of the clinical decisions. Now, things that were within the EMR thing, those things are okay, but when you have to go outside of it and you have to go across different systems, that's where you need to aggregate a lot of that data and bring that all together. Some of the multidimensional data analysis and insights started proving expensive, and we lacked those insights. And we wanted to become truly data-centric with the right connections to the various departments. So let's flip over to the next slide, and I'll talk about this and promise not to bore everybody with too much detail. So we started this journey with Owl, and in July of 2022. And really the goal was to unify a lot of our various data platforms and various data sources. We leaned heavily into the Microsoft suite of solutions. I'm not here to endorse, just transparency on what we chose to do. And really the goal was to actually to bring together our EMR, our HR systems, or even our scheduling systems into that common repository, so that we could get insights and visibility across those different environments. Like I mentioned before, when you have point solutions, there's a lot of good data there, but where the data really comes to life is when you could actually aggregate that and look at it across the various slices. So with that, and the reason why I brought up the underlying platform was not just to be able to build on some dashboards. It was really building this ecosystem that we could expand out as we go, and we'll speak to that in a little bit. But a big part of this whole entire ecosystem is the ability to have customizable dashboards with drill down facility, and even users have the ability to slice and dice information without having to ask IT for help. The last thing you want to do is open a ticket and wait for a response, especially when you just click on something, and get the data that you need right away. So what we achieved. So firstly, platform saved a lot of effort and money compared to running manual processes. Obviously, once you eliminate a lot of those manual steps, automation is a wonderful thing, and you get a lot of soft dollar costs, even some hard dollar costs to saving your efficiency. So that's a huge opportunity. Secondly, saving more than 600 hours per month in data unification and reporting. Thirdly, we also shifted expense from CapEx to OpEx, giving some more predictable financial outlays. But really, beyond the numbers, we're focused on that continued cultural shift in making data-driven decisions. That's an important piece for us. We want to make sure that all of our care partners across the entire organization, from leadership throughout everywhere in our homes, we are really focused on leveraging our data to help us drive and make decisions. So really that organization-wide mandate and really the team actually welcoming the KPIs. That's a huge piece of this. That's a huge piece of actually helping to drive better care for our residents. So we leverage it. We leverage our dashboards for census, for quality, HR, finance, different things, and really making our teams make better decisions with the data at their fingertips. My big advice, and I'll leave this slide with this one piece, is invest in data governance early. That is a big cornerstone to ensuring that you have a successful program. Leverage your partner with experience and capabilities, and start small and scale. That is the most important thing. So on the next slide, continuing on our journey, once we've had that unified data foundation, it's really cool what you could actually build on top of it. And we're going down the path of putting AI on top of what I always say, putting AI on top of our dashboard data. It's a lot more to it than just that. It's really about leaning into that data and how we could actually start doing things like generative AI and natural language interfaces. So executives can ask questions like, what's our current census versus budget, instead of actually having to train somebody on how to, click here, click there, slice like this, go like that. Okay, now you got it. Perfect. Now you got your census data. It's so much more natural to just ask that question and get the answers at your fingertips. So that's a big piece of what we're trying to accomplish. And now moving AI where it becomes more of a predictive analytics, and the team could identify risks throughout the organization, whether it's a fall risk or infection trends, or even look at census dips and try to predict where they are, what home it may be, what wing it may be, or what neighborhood it may be in, things like that. It gives you that kind of insight to really help to drive some of those decisions and shift resources accordingly. As we move into narrative intelligence, we can automatically explain anomalies and like why staffing costs spiked last week. Even in the future, look at scenario planning that lets you model what if scenarios, and if your occupancy drops, if you acquire a home, if all the what if scenarios that could come up. AI could help us with a lot of those things. Things that are predictable, we could schedule and we could build, but there's a lot of things that are unpredictable, especially in our industry. So moving to the AI-enabled future, we are also starting to look at ways that our AI solutions can enable natural language queries over structured and unstructured data from dozens of sources. So like I mentioned about the whole entire ecosystem, getting our AI agents on top of our dashboards is absolutely critical. But throwing some of our unstructured data into a data lake, that's going to give us even more insight, and that's going to give us even more capabilities. And again, this lets staff ask plain English questions and get real-time insights across the board. Whether it is on census or clinical or any of those dashboard data that we mentioned before. And our AI initiatives are primarily geared towards knowledge retrieval and a significant and significant shift in the near future around gathering conversational insights and even going into the system, getting some note summarization and automating some generation reports and just different angles from that standpoint. So this is definitely an evolution. It's not we're not at the end place. I don't think there will ever be an end place, at least for as long as I'm in the industry, which I do plan to be here for quite a bit. I'm not planning on retiring anytime soon. But I think this is going to be a long road and a long evolution for us. So with that, on the roadmap, start small, build trust, scale fast. The big trust factor is really not just your care partners trusting in the system, your care partners trusting in what you've built, but your partners trusting in the data. That is so important because, like I mentioned before, about having good data based decisions, you need to have good, clean data. And when the people that are using the system, they trust that data, they'll be able to make much better decisions. So really simple 3-step roadmap: unify your data, bring it all together, consolidate it, make sure it's clean, make sure it's accurate, validate it, double check, and make sure everything is as clean as possible and everybody understands what it all means. Empower that data with dashboards, establish common KPIs, enable role-based views as well. You want to make sure that you're not, letting certain data be accessible to certain people in the organization. And then cultivate that data literacy. So training is the most important thing to ensure that the staff fully understands how to leverage that data and so that they could be self-reliant. And then once you have that under your feet, then you could really extend it with AI and really start going after some of those capabilities. But your AI is nothing without your data, and without having that dashboard to be able to validate that data is accurate and ensure that data is accurate. Your AI may tell you stories that you don't want to hear, but once you have that in place and you're leveraging the AI, then there's some magical things that could happen. Like I mentioned about the natural language queries and automated narratives, and that could really unlock with deeper insights. So like I mentioned, start with some high value use cases, start small and scale. Make sure that foundation is designed well and ready to grow and ready to expand. So with that, Venkat, you have anything you want to add on that slide?
Nothing specific, Rob. That's perfect. You have given a complete journey of where you started, what the vision was, and how you are leveraging data and AI. The advice was perfect. Start small, build trust, scale fast, and then extend with AI. Back to you, Emily.
Well, thank you both, Rob and Venkat, for that really informative presentation. Robert, it was interesting to see how you're able to leverage the OwlSure tool to successfully sort and manage your data. We do have time for some questions with Rob and Venkat. So if anyone has questions, you're welcome to enter those into the Q&A box at this time. The first question that we received was, do you do any work in the fitness disease prevention field?
Yeah, sure. I can take it. Yes. So particularly, Rob, I will make a mention of not giving the program names and anything, but I will make a mention of how Parker has specifically leveraged certain things on wellness programs, which are fitness and disease prevention. So it's very difficult for senior living operators to track the efficacy of the fitness programs. So to do that, in fact, Rob and his team on the program management side have had the vision. Rob has provided the vision in terms of how do I measure the efficacy of the multiple programs that we run here. So the preventive care, as well as the efficiency of the programs, the efficacy and the value of the programs that are being provided to the residents, particularly in the senior living field, is measured with multiple dashboards, and it gives a lot of value terms of which program is very well received, and not just reception or adoption by the residents and the seniors of the home, but it's also the value that's being provided. So how is the wellness index being measured for its increase? And then the investments will continue, or the aggression in terms of expanding those programs will be much better when we see a lot of value for the residents in the program. And when it comes to disease prevention, of course, particularly on the nursing homes or senior living facilities, every hospitalization that was avoided is definitely a lot of value for residents as well as staff and the operators. So that's where the technology solutions will help. Something like what Rob had mentioned earlier. Where would a data solution or insight from such things help is if you have all the information in the platform that Rob had mentioned earlier, which he is leveraging, the risk changes or the ADL changes, even for that matter, if you have trackers, if you have source systems for that matter, ADL changes, the activities of daily living, if there is a change in the pace at which they're able to do or the number which they can cover for themselves, the engagement trends, are they engaging in multiple programs that are being there? Is a senior able to walk down to the library and pick up a book as much as he or she was doing 2 years ago? Is there a change there? Or is there an increased participation or a decreased participation in the exercise programs? Are there early warning signals in terms of even the clinical measures? Like, will you be able to find out if there is a UTI in the offing? Something like a change of habit of potential bathroom visits in the night. So all these things measured, that measurement can happen, particularly using the dashboards, and it's not just the dashboards, it's the insight, the crunching on the relevance or the correlation that happens between these multiple markers is what gives the important insight for the operators and the healthcare providers. So on the other side of OwlSure, we also provide such insights and valuable proactive care patterns for both payers on the population health side and acute care providers too.
Great, thank you. The next question that we have is, how do you handle HIPAA in this unified platform? What about privacy?
Privacy is critical. Yeah, I'll take it first step. Absolutely. Privacy HIPAA regs are absolutely table stakes. That's not even that's not optional. That is a mandatory that's something that we must do. And we ensure that any data element that you have access to in the production system carries downstream to the dashboards. So you do have to tag it appropriately and ensure that those data elements are protected. I think I mentioned while I was speaking, you want to ensure that that the employees, that the care partners that are accessing the data have the appropriate access, not too much, not too little, just the right amount for their job. And I love using the example of the simple one that resonates very well. Not everybody needs to know what my salary is. The HR can know that, and my boss can know that, but other than that, I'll tell my wife, and that's about it. So throughout the organization, we don't need everybody to take a look at what some of those data elements are. So if you don't have access to it on the product systems, you do not have access to it downstream.
Wonderful. Thank you for providing that information. The next question is, do you have an example of how you're training employees to make data-driven decisions versus their old habits?
So can you say that one more time? I missed a piece of that.
Sure. Do you have an example of how you're training employees to make data-driven decisions versus their old habits?
Think of a good one. I mean, we have access to so many different dashboards now. Within our HR system, we have access to how long it takes to actually onboard somebody from request all the way into to bring that into the system, and using that to help streamline the process, optimize processes, and looking at our fall rates, throughout the different homes. And even census is probably the easiest one that resonates very, very well with everyone. just going into that one dashboard to be able to see the census, and be able to just at a glance get that data without having to go to multiple systems to aggregate the data manually and put it on a spreadsheet and then email it across the board. When when the CFO wants to know what the census is, he doesn't ask for a report from somebody to email it. He just looks at the dashboard and he has access to that data immediately. So that's a classic and a great example that resonates really well. Just having access to that data immediately is probably the most important thing.
Perfect. If I may just add to that, Rob, the caregivers on the caregiver side, it's traditionally the question itself says it's traditionally caregivers relying on the familiarity, quote unquote, that they just knew the residents so very well that they can act when they notice something is off. But then the problem actually is changes are very subtle at first, and by the time it becomes obvious, then probably the resident is already dealing with a risk, a fall risk, or a hospitalization risk, or even a infection risk. So that functional decline should be stopped by this proactive insight. That's what Rob has very well mentioned in the beginning. From being reactive to being proactive by the decision. It's not just when there is a problem that they respond to, but the decision making is become predictive and proactive now. For example, you also mentioned in one of the AI generated additions, the nuts nodes consolidation. So there may be a daily care huddle when there is a shift change, probably for just 3 minutes or 5 minutes, where you see or notice the top 5 to 7 residents who are high risk, top residents to watch, something like that. That can be a dashboard, and start every shift with that, and note what the data is suggesting. That's what Rob mentioned earlier, is that the data is telling you a story. Because the intelligence is built in on top of the data that's in the platform, that is all stitched together, then you can decide on that one small preventive action. That is the proactive, and that is the data-based decisioning culture. And Rob has made a very compelling mention of the culture shift, the culture change. Everybody is not just looking at the data dashboards that are smart, that are very finely drawn charts. They're actually making decisions on that. And again, he also mentioned it. Sorry, Rob, I'll pick that one quote you said. You would definitely not want to be at the fag end of the service request queue. You don't have to do it, because no one need to necessarily become a data expert. And you don't need to even be an IT expert to solve or leverage these things. So it's just asking the staff to interpret the charts. That's the training. So there are very simple color-coded patterns and guidance that can give. Green, probably trending stable, if you're talking about the clinical dashboards. Some of yellow, well, there is a mild change, and then it can also indicate whether it's going south or improving, north, what it is. And red, a clinical intervention is needed today. So that's the kind of training that is going once we see the value, or once we see the data in action there. So the higher confidence that comes from what Rob mentioned earlier as a very valuable asset is the staff themselves reporting a higher level of confidence, because the decisions are guided. They're data centric. They're driven by data and not anymore guessed. That's where I'll pause.
Yeah, as you kept speaking there, I kept thinking of being able to see the forest through the trees, and sometimes you need to be able to step out and take a look at some bigger picture things, but knowing that those trees are there and every single one is really critical. So when you need to look at the forest, you can see it, but when you need to drill down and actually look at the individual trees and understand the individual diagnosis, the individual issue, the individual whatever it is that's happening, and I'm trying to keep it generic. But that's the value. That's the real value, is to be able to take action over those insights and take action over over that data. And it's not just looking at a big aggregate that says, "Hey, we're heading north." It's about having those details in there, so when you do need to double click on it, you could actually get the actionable insights and go solve problems.
Absolutely.
Thank you for that wonderful response to the question. We are running up to the end of the webinar time. There were a couple of questions in the Q&A box that we did not have an opportunity to answer. But we're going to follow up with anyone who asked a question that didn't get answered. We'll follow up by email afterwards so that you can get the information that you're seeking. We have a record of everything that was asked, so we'll be able to follow up separately. As we wrap up for today, we do have some key takeaways that we'd like everyone to remember from this presentation. The 5 takeaways from today's webinar show you how to get the most bang for your buck. The first one is to shift from reactive to proactive care. Use predictive analytics to anticipate falls and infections. Drive strategic oversight. Real-time dashboards give leadership visibility across census, staffing, finance, and quality. Maximize workforce efficiency. Unified data reduces manual reporting and highlights staffing bottlenecks. Deliver personalized resident experience. Use analytics to improve satisfaction and track progress. And finally, strengthen compliance and risk management. Standardized KPIs and audit-ready data support regulatory requirements. Thank you to both Rob and Venkat for today's wonderful discussion. And thank you to OwlSure for presenting this informative webinar. If we cannot answer your questions today, please feel free to reach out to Venkat. His email address is on the screen right now if you'd like to reach out to him directly. That brings us to the conclusion of today's webinar. We hope that you'll join us again for a future Argentum webinar or event. There's a little bit of information about those upcoming events on the screen right now. For information about upcoming webinars, you can visit argentum.org/take-5-webinars. For information about Argentum's upcoming Senior Living Leadership Summit, which is taking place November 17th through 19th in Scottsdale, Arizona, you can visit argentum.org/events/senior-living-leadership-summit. And finally, to learn about training, credentialing, and certification opportunities for executive directors, administrators, as well as any programs about community sales and marketing professionals, you can visit argentum.org/professional-development/professional-certification. Thank you everyone for joining us this afternoon. Have a wonderful day.
Thank you very much.